You're listening to the Doctors In podcast from martinclinic.com. Although we share a lot of practical and, in our opinion, awesome information, what you hear on this podcast is not intended to diagnose, cure, treat, or prevent any disease. It's strictly for informational purposes. So enjoy. Hello, I'm Dr. Martin Jr.
I'm Dr. Martin Sr.
And this is the Doctors In podcast, and this is episode 184. Now, it's crazy to think about that, 184 episodes. So we've been doing this every week for a long time. There was a couple years ago where we took kind of summer off, and then we started getting emails from people. And
don't take the summer off.
Don't take the summer off. So we're heading into summer, not really, because we're recording this. It's the May 8th today that we're actually recording this episode. And just literally, this is the latest ever. I just picked up my motorcycle from storage.
Yeah.
Brought it home today.
It was so happy to see you.
Oh, it was crying tears and separation anxiety and everything. It was fantastic. But this is the latest that I've ever got my bike home.
Usually we get it out sometime in April, even if the weather's not fantastic. But this year there was no getting it out in April. It was... Yeah,
it would have been tough.
The climate change is true.
I don't like riding in
cold.
snow. Yeah, I don't like riding in snow. But anyway, so 184 episodes. Today we're going to talk about something that was in the news recently, and it affects a lot of people, and it's about proton pump inhibitors, so antacids. And proton pump inhibitors are a little bit different in the sense that they shut off the hydrochloric acid valves. They just turn them off. So it's hard to get heartburn if the valves are not even on. But there's a huge but. The problem with that is it's not like you don't need the hydrochloric acid. Mm-hmm. The problem with heartburn is, in our opinion, modern medicine is looking at it completely wrong because it's not actually a problem of too much acid. It's actually a problem of not enough acid.
Yeah.
And that little valve at the top of the stomach, that little sphincter valve, not doing its job properly. And that creates an issue. So the little acid they don't have enough, goes up into the esophagus and obviously creates a whole bunch of problems. So the pharmaceutical industry, because that's a big problem, and we're going to talk about the actual causes of this coming up, why people get it in the first place, and it's not what the TV would have you believe, but the media or the pharmaceutical companies jumped on this because every one of their commercials is basically telling people that they can continue to eat the exact same way they always have, but just take these little pills beforehand, and everything's going to go well. There's no mention of, in the commercial of a life-altering diet or any kind of change whatsoever. It's just like, hey, you're going to the ball game and you want to eat
10 hot dogs.
10 hot dogs and drink beer and all that kind of stuff. Take a couple of these pills beforehand, and guess what? You're not going to get any heartburn. Here's the problem with that, and this is what the news story was about, is these things were never meant to be taken for any duration at all.
Yeah. Temporary, right?
They were meant to be temporary. And because most people were not aware of that, and they continue to get heartburn every day, because once you have, and we'll talk about the cause later on, but once you have a problem with stomach acid and insulin resistance and high circulating insulin and all these kind of things, you're going to end up with heartburn pretty consistently. So they have heartburn every day, so they're taking these proton pump inhibitors every day because heartburn, it's a good name for it. It hurts.
Yeah, it hurts. It hurts big time. It's very uncomfortable.
It's very uncomfortable. And, nobody wants to live every day with heartburn. So, it makes sense. They pop either an antacid, or if it's a real problem, they start to take these proton pump inhibitors.
Yeah.
And they're over the counter now.
Yeah.
So, anyways, now it comes out, and we've talked about this years ago, because even in their own literature that comes with these medications or these over-the-counter pills, it talks about not using them for a period of longer than, I think it's 2 months.
Yeah.
So what's happening now is that now the news is starting to say, hey, wait a second, you may not want to take them for too long.
Yeah, and here's the headline that sort of bothered me, okay? Because it says, doctors are warning, okay, that proton inhibitors could lead to some pretty serious side effects. Doctors are warning. So let me just say this, because this is a pet peeve. I meant to mention this the other day when I did a Facebook about this. I meant to mention it because doctors are not warning. No, they're not. This is sort of a little bit of a news story, but it didn't come from the medical profession, didn't come from the Canadian, Medical Association or the American Medical Association. It didn't come from that at all. It was a couple of researchers when you dug up, and they're making warning of it. So what I say is this is really bothers me because this is something we've been talking about, like you say, for a long time. And they've known the side effects for a long time. And nothing has been done. As a matter of fact, I call on both these two professions where I think they've dropped the ball. One, the medical associations or whatever, or the College of Physician Surgeons or whatever, they didn't put out a warning to the doctors. They should. Secondly, and once we get through the podcast, people will understand how serious the side effects of these proton inhibitors are. Secondly, it's the pharmacists. These guys are professionals, right? They go to school for a long time. They come out and they're professionals, but they have a conflict of interest because they should have put doctors, you guys are prescribing this way too much and way too long. That bothers me because these guys are professionals, and as a matter of fact, in our province, Ontario, they're starting to, and maybe not a bad idea. You know what? You can go to your if you just need you got a sinus infection or whatever, you can go to the pharmacist. That hasn't happened yet, but I think it's coming.
Where they'll be able to prescribe.
They'll be able to prescribe a short duration antibiotic or whatever.
Listen, they know drugs.
They know drugs. They know the side effects.
I've had great conversation with pharmacists, and they, at least the ones I've talked to, they understand
the side effects.
The side effects, because they talk to a lot of people. And in fact, a lot of times a pharmacist talks to a patient a lot more than even their doctor would, because they leave there with a laundry list of medication, and the pharmacist is there trying to explain to them.
To warn you, right? But you know what?
But how many people have heard? How many times? How many people have actually been warned by their doctors to not take this for any consistent length of time?
I've never heard of one patient. And listen, I'm a question guy. So I get information out of patients, right? Because I want to know their story. I want to know where they're at. I want to know what's happening. I never heard, my doctor said, you can't be on this antacid for a long. As a matter of fact, they're almost encouraged, nothing's changed. So repeat. Well, and like you say, now you can actually get some of these.
They're right over the counter.
What is it? Prepulsid, or which one is the purple? What's the purple?
Yeah, purple
pill?
One, Nexium,
right? You can get it right over.
Is that right? Nexium, I think it is.
You have to go to the pharmacist.
But you don't have to go to your doctor to get a prescription.
But what bugs me, and I don't want to spend the whole time on this, but pharmacists got to be much more responsible. Like, you know what? This is your 15th time you've come back in the last 3 or 4 years to get this.
Person's taking it consistently.
You know what? This should be flagged. You need to, look at, because, again, we'll get into what can happen with these things. And I'll tell you, when they start warning you about some of these major side effects, and I mean major side effects, look, I think people, just from the podcast, the thing that I did on Facebook, how many of our patients have just sort of, you know what? Nobody ever told me that.
No, they don't talk about it.
Nobody ever told me that, right?
And so let's talk before we, what we're going to do today is we're going to list some of the biggest problems when you consistently take proton pump inhibitors. The biggest problems on different organs and different things that are going on, and we're going to go through that just so that you're fully aware. But let's first break down what's actually happening with what happens when somebody has heartburn. So as we mentioned, heartburn, if somebody has chronic heartburn, that's a failure of a few things that's going on. Right off the top, right? That's a failure. Normally, the pH of the stomach obviously is acidic. It's low. And as you're secreting hydrochloric acid in your stomach, the pH drops.
Big time. Or at least it should.
It should, right? If you have enough hydrochloric acid, your pH levels drop. And then that signals that little valve to close at the top of the stomach. That's how it's supposed to happen. It's like you put food in your stomach, hydrochloric acid gets secreted, the pH of the stomach decreases, and then that little valve closes, and that valve shuts off the stomach from the esophagus. That's what happens. And that's a normal thing.
Yeah,
that happens every time you eat, right? Every time you eat, you put something in your stomach, you release hydrochloric acid, your pH of the stomach drops, and the valve closes. It keeps the acid in the stomach. It digests the food. It moves down to the next part of the digestive system, gallbladder, pancreas, liver, and it goes into the intestines. So that's normal. But something happens along the way where all of a sudden you do not secrete as much stomach acid as you used to. So think about it. You put acid into your stomach. It's not enough to bring the pH down enough so that valve closes. So the valve doesn't close because the pH hasn't dropped enough. So now you have acid that can go into the esophagus a bit and give you a heartburn.
Yeah.
And that's a failure of stomach acid. Now, there are different reasons why that happens. And, I've read different things, different experts talking about as you get older, you're definitely more likely to have an issue with stomach acid and digestive enzymes and all these kind of things. And it makes sense. We see that and we hear that all the time. But that's what's supposed to happen, right? And now when somebody has chronic heartburn, that's no longer happening. And then the stomach is built for acid. The inside of the stomach can be very acidic. The acid doesn't ruin the stomach, and it can handle
like
it.
A furnace.
Yeah, it can handle it.
Like it can take that heat big time.
But the esophagus, it's not built for acid. So you can imagine when it gets there, it's burning. Well, you do that enough times for a long time, that can also lead to some serious esophageal stuff like cancers and all these kind of things. But now think about this. You take an antacid or you take a proton pump inhibitor, and now you're no longer putting enough acid into the stomach at all. But it's so little that it's not even going to really go up into your esophagus. But how in the world does food get digested? That first part of digestion, as the stomach empties into the first part of the upper small intestine, and the gallbladder kicks in and the pancreas kicks in.
They're throwing bile in there. And
how in the world? Imagine a strain on the digestive system now that this protein and these things are supposed to be broken down in the stomach get into the top of the bowel relatively undigested. I mean, that starts you. So that's where the problems really start when you start taking these drugs, because you're not breaking down food. And they always, there's a saying, you are what you eat, but that's a half truth. Yeah. You are what you absorb. So when the food gets into your intestinal tract, now that strains your gallbladder, that strains your liver, that strains your pancreas. They don't do their job properly. People also forget that acid, part of the job of the stomach acid is not only to break down those proteins and other stuff and break them down into mush and all that.
Mulch it down to nothing.
Exactly. It's also designed to kill
bacteria.
You consume a ton of bacteria, a ton of candida, yeast, everything. It gets into the stomach's contained, it digests it, it kills everything, and then once it gets through, whatever's left, the gallbladder helps kill. Now,
the bile is very acidic.
That's right. Now, the food comes into the digestive tract, or into the upper intestines. It's not broken down. There's candida, there's junk that shouldn't be there that gets into that top part. It overworks your gallbladder, and you start having gallbladder issues. You start having fungus and candida and parasites that can get through that should never get through. And that is extremely common.
Yeah. Oh, yeah. And that's why you see so much H. pylori today. H. pylori will never hurt you if you have a good stomach. If you have good stomach acidity, H. pylori, even C. difficile, and others that are, now are becoming really super bugs and very resistant. But one of the biggest issues is this whole thing about, like you said, the stomach acidity starts there. And, with people don't have good acidity in their stomach. One
of the long-standing side effects of antacids and proton pump inhibitors that most people are aware of, and I saw this because my background's treating sports injuries, is somebody had a long history of this. Their bones were terrible. Yeah. The little minerals that you need to get from food, you're not getting it if you're taking antacids consistently. Your bones are going to pay the price. And you know what's so funny? a lot of these like chewable stuff, they add calcium to it because they kind of know.
Yeah.
So they add calcium. It's a form of calcium that's pretty much useless for your body in the first place. So you're not gonna do anything with it. But they add this like these various forms
Tums for calcium, right?
All these things. That's right. Chew them for calcium, right? Yeah. But it's funny because those things hurt your bones. In fact, if you go look up, that's one of the most common side effects of chronic antacid use is weak bones. Yeah. That's the first thing. Yeah. But we're not even going to talk about bones. That's just a given. If you have a history of these things, your chance of osteoporosis is through the roof.
Through the roof.
Yeah. I mean, that's...
Guess who's the most susceptible? Women.
Yeah. Through the roof, right? Yeah. So we're not even talking that. Let's talk about a few of the common effects of proton pump inhibitors or antacids. And the first one we got to talk about, because if they're, again, we've kind of mentioned this on a previous podcast, the most common deficiencies, and we should do an episode on that because I think that would be good. B12.
Yeah. You just, there's not a chance that you're absorbing B12, you're on an antacid. If you're on a proton pump inhibitor, just assume 100% you got a deficiency of B12. And probably iron, too.
Yeah, and let's talk real quickly about B12 just for a second, because the problem is, it's kind of a pet peeve of ours as well. We're going through a lot of pet peeves today, by the way. It's kind of a...
Sound like my rants on Thursday.
Yeah, it's just kind of like a little bit of a pet peeve is that I'm trying to think at the top of my head. I can't think of another vitamin that's tested so poorly. I read a thing from a researcher said that the testing is so bad it's worse than a coin flip if they're going to detect even if you have it. Then there's no consensus on what optimal levels are. So
the
testing
test is 100 years old.
Yeah, it's terrible. It's a terrible test. Yeah. And they rely on a test that's a less than a coin flip. And even if you are on the low end, you're not low and by their standards. Yeah. So they don't.
I was saying to a patient the other day, just on the thing of B12, nobody cares about B12 anymore. In the medical profession, I hate to be negative, but in the old days, I mean, doctors actually gave you B12 shots. Now, I bet you there's very few physicians even giving B12 shots anymore, just because it's just not part of they're not even looking for it. So it's just a vitamin.
And they're not going to pick that up when you go there anyways because the
blood work's so useless, right?
Because every system in your body uses B12. You can get symptoms anywhere. Now, you may get fatigue, and that's a very common B12 symptom. Yeah. But here's a list, and I put together, and we're going to put a nice graphic in our email to our newsletter subscribers. So if you're not, join up, and you'll get this graphic about how it affects every system. And these are things that you would never even associate with B12, but these are common. Yeah. These are common. So it affects your cardiovascular system, right? So fatigue is a big one. Heart palpitations. Yeah. That's a big one for B12. Yeah. Yeah. Shortness of breath, right? Somebody has a shortness of breath.
Go up a flight of stairs and you're sucking for air. You know, you say, I'm out of shape. But no.
That's a good chance your oxygen, it's like your B12 is just not doing its job.
You're yawning a lot?
Yeah. Digestive system. How does it affect your digestive system? Well, it can cause diarrhea if you're low. And here's another one, too, which is a lot of people don't understand. They talk about this. You know, a lot of people get a lump in their throat. That's a strong indicator that you got a B12 deficiency and a pretty good B12 deficiency. Yeah. That whole lump in their throat, right? They have difficulty swallowing or they just feel like it's constricted. That's B12. Yeah. They're low in.
A lot of women have that, eh?
It's so common. And we hear that a lot. But again, it's because they're B12 deficient and they're significantly B12 deficient. Muscular system, clumsiness, muscle spasms and twitches, shaky hands, weaknesses. Here's the nervous system effect. Confusion, dementia, dizziness and balance problems, feeling faint, irritability or anxiety, memory loss, struggling to find the right words, numbness, tingling, burning of sensation of the hands, arms, legs, and feet.
And mouth.
Poor concentration. Because your nerves need B12. So there's a lot of nervous system. And then even people don't even realize this with your eyes and ears. Aversion to bright lights. That's a big one. Tinnitus. There's a lot of cause of tinnitus, but B12 deficiency is another cause of tinnitus. Mm-hmm. Worsening vision. Somebody who's just like their vision's falling off. If your eyes are aging faster. Now, we get a lot of requests in our Facebook group to do one on eyes. So we'll do one. We'll do a good one on eyes. But if your eyes are aging faster than they should be, there's a good chance that your B12's low.
Yeah.
And here's the thing. If you are taking proton pump inhibitors, you are low in B12.
100%.
Yeah, that's as close as a fact as we're going to give. That's a guarantee.
You know what? I've said this before, too. Almost every med takes the B12 out of your body. Metformin is famous for it.
Yeah.
But if you're taking any kind of antacid or proton pump, you just have to assume that your B12 is extremely low.
All right, so if you got a history of antacid or proton pump, you're going to be low in B12, and then we just shared with you all the effects that could have on your body, right? You mentioned anemia. A lot of women especially are anemic for a lot of different reasons, but another one is their digestive system isn't working, and they're taking antacid or proton pump inhibitors. Yeah. And then think of all the effects of anemia. And it's funny.
They're not eating enough red meat either.
No, and they're scared away from it. Yeah. And
it's the boogeyman.
Yeah, they're just there's a systematic.
I had somebody in the office again today, just because I'm so used to answering it, but it always surprises me when they say it again. Well, doc, I can't have that much red meat. It's going to give me cholesterol. And I said, okay.
Yeah.
I have to always remind
you got to give it to the cholesterol drug companies because they've turned that into. Wow. That's still something that people look for. It's great, but anyways, it is what it is. It is what it is. It's amazing that that's still a thing. But you look at anemia, and you've talked about this before, you and I off air, how when somebody is anemia, they look anemic, right? Like you can look at somebody and guess if they're anemic.
Yeah, they got real dark circles on. Like, I'm very observant in the office, and you come in and go, I don't even have to look at your blood work. I just turn around and I look at the patient and I said, man, you are anemic.
Yeah, right? And they have all the symptoms or some of the big symptoms.
They don't feel good, and their hair's falling out, and
Yeah, and your hair needs iron, right? And your hair needs iron. We have a great video on our blog section of our website on the different causes of hair loss, because the hair is a great biomarker. And if you're healthy, your hair generally is pretty healthy. Yeah. When you're not healthy, hair is, like we've talked about before, it's expendable. It's like the guys in the movie. Your body will sacrifice your hair for your other things. So if you have a limited amount of iron, it definitely isn't going to put it in your hair. Yeah. It's going to send it where it needs it. So the hair is going to get sacrificed.
It's going to make red blood cells. It won't.
So hair pays the price, right? So let's talk. Okay, so we talked about B12. We talked about anemia. Let's talk about the effect of proton pump inhibitors on the brain.
Yeah, because, again, I think it does come back to partly, if not the major thing, is what it does to your B12. And your brain, we did a podcast, I think, a little while ago on how your brain shrinks.
Yeah, literally.
B12, right? Atrophies, right?
The brain atrophies. And if somebody's like, well, I don't know what the word atrophy means, it's wasting. It's just a fancy way of saying wasting, right? Shrinking. So just think of the brain as rotting away. It's wasting away. And as we age, a little bit of that is normal, right? Our brains shrink in volume as we age. But when it happens faster than it should, that's a problem. And as we mentioned in that episode, dementia and Alzheimer's are usually characterized by smaller brain volume. So that's not a good thing. You don't want your brain to shrink too much. And B12, if you're low in it consistently, your brain, which is why, I've read, it's interesting, they call vitamin B12, they'll talk about dementia, like for this, if it's specifically, it mimics, right? It mimics dementia for some people. And when they get their vitamin B12 levels up, it's amazing how much better their brains are. But yeah, so brain is a big one. Let's talk about the effect on the heart.
Well, we, again, talked about heart palpitations, bacteria that can affect the heart. We know, like dentists have often said this, right, that orally, if you got bacteria that can get into your bloodstream because your gums, you got gum disease, you might not even realize it, but that kind of thing can attack your muscles of your heart. It can, cause inflammation. And so the heart is affected when you don't have good acidity in your stomach because of, again, these bacteria. And
they would never tie that in.
No.
Never. If somebody died of a bacterial infection of their cardiovascular system, they would never get tied to that. Never.
No. No, it would be something you wouldn't even
No.
think of unless you're doing research in the area.
Yes.
But you look at pericarditis, which is something that's much more common today than ever, where you get the exterior of the heart, the pericardium, and a lot of that is bacterial. It's and we would even fungus, like fungus gets in, spreads through the bloodstream, right, because of not having enough acidity in the stomach. Big problem.
All right, and let's just kind of wrap things up by talking about the effect on the immune system. But again, it goes back down to if you look at the effect of not having enough acid in your stomach, and then even worse, turning it off because of these proton pump inhibitors, then stuff gets through that shouldn't, and that activates your immune system big time. That leads to inflammation.
Autoimmune, big time.
And one of the issues with inflammation that a lot of people are not aware of, because, inflammation can mean so many different things, right? I mean, there's systemic inflammation. There's very specific inflammation around the ankle, for example, right, where the ankle swells up. But the thing about inflammation that one of the aspects of inflammation is, for example, this past weekend, my daughter, Addie, your granddaughter, was at a dance competition in just kind of middle of Ontario, around the Aurelia area. And as we're driving back, we got up to early in the morning, we're driving back, and as we started heading towards Parry Sound, which is a big lake, right? It was really foggy, and so you couldn't see a couple of feet in front of your car. Well, inflammation does the same thing. So imagine cells that have to communicate with each other all throughout your body. They send signals back and forth, and hormones are circulating, and then the hormone goes to the cell, and the cell has an antenna that recognizes it, and they communicate the message to the cell, and all these kind of things. Well, when you have inflammation, all that kind of communication stuff, it gets messed up. And when that starts to happen too much, then you start getting into autoimmune disorders, because your immune system is not working properly. It doesn't know which cells are its own. It starts attacking things. So inflammation, not only does inflammation lead to premature aging, it ages your brain faster. Midlife inflammation leads to dementia, all these kind of things. It also can lead to autoimmune disorders, and we see so many more of them today. Again, it would never get tied directly to the low acid in the stomach, but from a functional healthcare standpoint, that plays a role. It's like in hockey, it gets an assist, right? Yeah. These things get all assists. And then because of these things, you end up with autoimmune disorders, or you end up with an infection in your heart, or you end up... So these are all little step-by-step things that happen. At the end of the day, you need your acid in your stomach big time. I mean, you need every ounce of it that's secreted. Yeah. It has a very specific purpose. It kills stuff. It breaks down stuff. And when you don't produce enough of it, man, you may be able to do that once in a while, but you do that consistently, and that's what we're starting to see. And that's why that article came out warning people. It's like, hey, if you've been on this stuff for a few months, you might want to get to the problem. Now, let's end off. We got a couple more minutes. Somebody comes to you and says, hey, I got chronic heartburn. What do you tell them?
First thing has to change is your diet, because the number one reason for acid reflux is insulin resistance. It's the body screaming at you that you and carbohydrates have a bad relationship. You and crappy carbs and these vegetable oils, very inflammatory. Your body, it's a sign. It's one of the number one signs, and I find that, the vast majority of patients, when they change their diet, watch their sugar content, and just realize, number one, that's it. It's food. So, and we're food doctors, so we just say, hey, change your diet. Cut that out. And it's amazing that usually gets better with that one change. Secondly, of course, we look at a lack of digestive enzymes. We want to break the food down, so we assist the body by giving it proteolytic and good enzymes to break it down with all of a broad spectrum enzyme therapy, because that really, really helped. You know what the third thing is? Because I mention this to patients a lot. You're usually dehydrated. Like, one of the things I find, you're just not drinking enough water. And water is important for proper digestion And so, again, I just say, your body might be screaming it's strictly dehydrated. So start drinking water. A lot of people don't drink water. They don't think they need it. They drink everything else, but they don't drink water, right? And water is water. Only H2O is water. So anyway, those.
Well, what's
three of
funny
the big
is
things.
when you did that Facebook Live a while ago, it was Thursday morning, so it was your doctor is in thing that you do every Thursday morning. You were talking about water, and you were just talking about how guys complain about water. And it's funny because a friend of mine that I went to college with, his wife was watching it live.
Oh, that was hilarious.
And she recorded the section of you talking to men, and then she held the phone to a buddy of mine and was using you to lecture her husband.
And it was the face she had. It was
it was so
hilarious.
funny. She had a face like a duck face, right? Like a kind of like,
I
told you so. And then, so you literally, and he lives in Pennsylvania. So you were literally giving a lecture on behalf of a wife to her husband. Yeah. She's holding the phone up to her husband, and you're lecturing him on a Facebook Live. So I was laughing. Actually, I got a recording of it. She sent it to me, so I'm going to send that out for people because every time I see it, I laugh because I just picture my buddy on the other end getting lectured by you about drinking water. So he has to hear it from his wife, and then you're talking about it, so you gave it to him as well. So it was very funny.
Dehydration is an important factor there.
Well, and, anyways, it was funny because even the faces you were making about men complaining about they don't like the taste, So anyways, it was very funny, but I just wanted to tell you that you played a part in lecturing a friend of mine in the U.S. about drinking more water. So, but anyways, all right. So we talked about a lot of stuff. At the end of the day, if you need to use proton pump inhibitors and you're using them, that's literally a Band-Aid. That is the equivalent of driving down the highway, your engine gets loud, and you're just turning up the radio. That's all you're doing. You're not addressing the problem in any way. So if you're serious about actually addressing the problem, then the information that we shared today is a good place to start. There's no question. And if you are using proton pump inhibitors and you have been for a long time, again, look at all the things that may be in your future, and I would definitely take steps to protect all those areas. But again, thanks for listening, and have a great day.
Thanks for listening to the Doctor is In podcast from martinclinic.com. If you have any questions, you can reach us at info@martinclinic.com. If you're not a newsletter subscriber, you can head to our website and sign up for free. We also have a private Facebook group that you can join. It's a community of awesome people. Finally, I do a Facebook Live every Thursday morning at 8:30. Join us again next week for a new episode.